Here are 2 scary things that can happen at the end of life, but they are totally normal. A lot of people think their loved ones are suffering at the end of life, but I'm going to explain to you what's actually happening. So trigger warning, I'm going to show you a video, which I do have permission to share, and this is not my patient.
You see it. You can see it from the doorway.
Why was it doing that?
It was just working overtime. I haven't listened to video to Amanda.
So, the death rattle. What is it? It's actually called terminal secretions. Many people think that the sound that they're hearing at the end of their loved one's life is coming from the lungs. So many people think their loved one's drowning, or this must be really hard for them, when in reality, all it is a little bit of secretion that is building up in their loved one's mouth. Now, why is this happening? It's happening because all of us are creating saliva throughout the day, and we're unconsciously swallowing it all day long, just like right now. But at the end of life, our mouths are still creating saliva, which is good because it's keeping the mouth moist, but our brain is no longer having us swallow that saliva. So it's collecting a little bit in the mouth, and then with each breath, it's causing a gurgling sound because the breath is going over the saliva. So it's very, very benign. It's no big deal. It just sounds awful. So there are things we can do. Positioning can help. So having your loved one sit up, or even turning your loved one over so the saliva comes out, or medication we can always give to dry the mouth out. I'm not particularly into the medication because I feel like then it gives the loved one dry mouth, but it is something we can do if it's really bothering the family. The other thing that really bothers people is changes in breathing. At the end of life, this is literally expected and normal and will happen with everybody. It is a biological response of the body just slowly shutting down. Looks scary because we're not used to seeing people have different types of breathing, but it's the most normal possible thing that can happen at the end of life, and it's not bothering your loved one. How do we know? We know because we look at the person who is dying. If the person who is dying looks like they are sleeping and they're comfortable, but they're just breathing differently, that is what's happening. I always try to explain to people, dying people are like babies. So we know that babies are okay or they're not okay by how they're acting. Babies can't talk to us, but if a baby is crying or fussy or restless, we know something's wrong. And a dying person is just the same. We know if they're okay versus not okay by how they look and how they act. Also, medical professionals have many non-verbal scales we use to make sure that your loved one's okay. So we go by how they look. And just know that the breathing changes at the end of life are completely normal and to be expected. So trigger warning, here is another video that will show you the different types of changes in breathing at the end of life. And again, this is not my patient, and I do have permission to share these. So I know this is scary, but the more we know, the more we see this, the more we learn about it and normalize this topic, and the less you fear, the more beautiful moments you'll be able to create with your family during this difficult time. So make sure you subscribe to my channel if you want to learn more and educate yourself about death and dying.